My name is rigour. I am currently pursuing Masters in Public Health. I chose KIIT because KIIT is a strong faculty, research-driven curriculum and practical exposure in public health. It is a faster growing domain and we should think about health as an asset. From the department we are getting strong mentorship. We are getting strong access to research facilities. They are also giving interactive workshops to get some practical experiences. Along with, they are also providing us with internships and field work. During my first semester, I have visited the KIMS hospital for my field visit. I have visited all the different departments and get to know all the facilities they provide. I have seen that people stay in different communities, like vulnerable communities. They are also staying in the society, but they don't get the benefit that we get. To bridge this gap, I want to pursue this public health.